Hello, all. Let me see. Hi, Lorraine. Can anyone say hello to me? Okay, great. Thank you, Tanya, for that. We will give others a moment to come in. Two-hour meeting. Meanwhile, I will share. Hi, Ned.
Hey, Mary.
So I just want to make sure people who do want to say something can. I think, Lorraine, can you hear me? Well, welcome to those who are here. We are just waiting a few minutes because we did have registration and we know that some other people are hopefully joining us today.
Mary, I unmuted Lorraine.
Excellent. I thought I did, but it's showing that she's muted. Hi, Fran. Yeah. Hello, Anu. We do have folks muted, but we could unmute. It's a small group. And we do have chat. So if you have anything, any questions, you can put those in the chat. I'll keep my eye on it. And then after the program, I'll leave a few moments. I'm going to try to make sure that we can all go, and be and be on time and have our meeting, have this presentation be over by maybe 2:55. So I'm going to go ahead and start the presentation. Is anybody against that? Okay, great. Thanks, Tanya. This is our first of its kind, and so we, let's see. Let me make sure I open just one moment, presentation. Okay, this is the point. Well, yeah, I can see you. I just can't keep a good look at the chat. So if you would like to, again, put something, if you'd like to speak out, I think some of you are unmuted. Welcome. Welcome to our program, The Magic of Adult Day Health, Nurturing Mind, Body, and Connection in Dementia Care. My name is Mary Caldwell. I am the staff gerontologist at Skylark Senior Care. I am not Dr. Caldwell. I'm not a doctor or a nurse, but I am a clinical gerontologist, which means I've worked on teams with nurses for most of my career as a gerontologist. And what gerontologists do is we study and research aging. So that's a pretty broad field. I have a specialization in Alzheimer's and related dementia, and I've been doing this for about 15 years. So we shall just begin our program. So this is the meat of what an adult day health program does and what we do at Skylark. This is a picture of our Skylark Adult Day Health in Johns Creek from the outside. We're open Monday through Friday from 8 to 4. We serve breakfast, lunch, and snack, and I'll get into that a little bit more as far as nutrition. We are a regulated healthcare facility in the state of Georgia, and that means that we have nurses on staff daily and can respond to any medical need or emergency. We can respond and we can give medication and generally get a lot of help from our nurses keeping people healthy. We are staffed, as I said, by nurses. You can have social workers. Of course, Skylark has a gerontologist, CNAs, activity aides, and activity directors. The different ways that people pay for adult day health that range from private pay to VA, as you can see there. There are other ways. This is very beneficial throughout any stage of dementia. And we provide, as I said, that medical oversight, which makes us different than a respite. You will see respites in churches and different community settings that do not have the medical part as we do. So we provide a comprehensive model of care that really for our members becomes the care team along with your physician, your neurologist, and others and family members, anybody that's on the care team. So we just add to that. I'd like to talk about the science behind adult day health, because although when you come into Skylark, you're going to see what really looks like a very, cheerful, uplifting community of people in a senior day setting. And yes, we have wonderful activities and an activity calendar, but there is a method behind all the things that we do. And there's a lot of science, evidence, research behind how does adult day health benefit people. So in general, through the research, we know that participants at Adult Day Health really have fewer hospitalizations. They have better long-term physical and functional health. Functional meaning, walking independently, toileting independently, eating independently. It really fosters independence. Subjective health refers to how someone says they feel. So there is definitely a mood and a physical health benefit to adult day health. So people that attend adult day health tend to say, yes, this helps and we enjoy this. They require fewer medications generally, and definitely it can delay or prevent long-term care placement like assisted living or memory care if the family's goal is to keep their loved one at home until the end of life, or usually the real goal is to keep someone independent for as long as possible. The care partners also benefit in that there is reduced stress, reduced worry and depression. That is because you are getting some very solid respite and time for yourself and time to care for your own health. But you also, as I said, get an instant care team at Skylark. So you've got nurses and our executive director, just and me, many of us, and we're there for you, and you can talk to us and we understand, the challenges. And that leads to improved mental health, well-being, and caregiving confidence. Because if you have a question, we're right there to help you with that. You will see that I have some citations. I'm a social scientist, and I do believe in providing evidence-based care. So this is not what Mary thinks or what Ned Morgan's the owner thinks. We are basing what we do and the ways that we support you on evidence. And I think that's very important. So the last page, there is a citation page, and I guess we could share this as well. So the why, why does this work, and what does the science? Let's dig into that just a little bit more. If I can move this, I'm going to minimize this. So I can't see you at all now. So do speak out if you can't see something or you need to, pipe up. But day programs provide a home-like atmosphere that seems familiar. And that's important, because in Alzheimer's and related dementias, uh, new environments and any change in routine is very challenging. And so that's why at Skylark, we seek to have that home-like feeling. So we want this to be someone's home away from home or their club. There's a lot of peer interaction, and that just happens naturally, but we also facilitate that daily so that it's deep peer interaction. So you're not just sitting next to someone. We share our personal narratives, the members do. What did I do in my work? What is my family like? What do I like? We facilitate a lot of discussion, which leads people to get to know each other well and form trusting bonds. And of course, the safety resulting in reduced behavioral symptoms. So the behavioral symptoms in dementia, which are called BPSD, that stands for behavioral and psychological symptoms of dementia. This disease is physical and brain-based, so you don't see it on the outward body. What you see are behaviors like anxiety, frustration, sometimes anger, confusion, those kinds of things. And adult day health programs with all of these interventions can reduce those symptoms. Also, continuing care. I feel like I've I've covered that we have resources like our virtual caregiver support group each month. Um, and then just naturally we're there to help and support you and answer any questions you might have, which definitely reduces stress. The adult day health also supports self-directed behavior. I wanted to add this slide because there is quite a bit of science here that says that these lifestyle interventions reduce risk, and what we say as scientists is may delay progression. Well, there's almost 40 years of research that says that this does benefit. And now the research is coming out that these lifestyle interventions do delay progressions. And here you can see some very wonderful studies, and some of them very recent. At Skylark, we have a proprietary program, which means that we came up with it ourselves years ago. And in fact, that's how I met Skylark. I was with the Alzheimer's Association. Skylark was really the first adult day help that I know of to say, hey, could you come and talk to us? And we have many of our members that are living with Alzheimer's or related dementia, and we want to know how to best help them. So what should we do? And so, we did came and talked to Skylark, and then through that conversation and other research, this program called Brain Bloom was developed. And this is Brain Bloom. In Brain Bloom, we are integrating those 4 lifestyle interventions through engagement, deep engagement. And that's the type of socialization that helps in dementia. So not I went to Wendy's and saw some people, or walked through the mall and waved hello to some people. This is community engagement and forming deep relationships. So this is something that Skylark is really all about. Mind. What does that mean? Together, we learn new skills and we learn new things. We're practicing lifelong learning. And that is where like I said, we learn new things together. Yes, we do brain puzzles, and we do, word games, and we have fun with it to kind of spark memory. But the thing that really helps delay progression in Alzheimer's is learning new things together. So let's say, we may be learning about birds. Well, we're learning that together, and we're really learning new things. And that is what makes builds the brain's resilience to stand up to this disease. We also think that joy and just having we call it spirit, but having a peace of mind and a safe place. We do have faith engagement, as in Bible study, although if someone does not enjoy that or does not want to participate, they certainly do not have to. We do not have any religious affiliation. We support all faith. We support the faith of all of our members, but we do believe that it is important to have hope, to have, support in that way. And then we move, and that's a big one. We move a lot. We have therapeutic yoga at both of our centers several times a week. We have, if our therapeutic yoga instructor, Kathy Alvarez, is not there, then we are doing other exercise. And sometimes that looks like everybody's playing chair volleyball or balloon hockey or cornhole, or we're going for a walk. Both of our centers are located in nice areas where there are trees, and we do get out and walk around a bit, but that's very important to just move. We certainly understand that some people have walkers and canes and maybe reasons why they have to limit their movement, but it's still good to stay active to the point that you can do so safely. It's very good for the brain. the restorative power of our program is really in the person-centered, strength-based mentality behind it. When a person is at Skylark, they're not seen as someone with Alzheimer's. We see the person. So we honor the individual history, preference, and needs of that person. And we do get to know those. We make that a priority right off the bat. And that is very important. We build on current abilities. So what I think is one of the very best things about Adult Day Health and Skylark is that when a person comes to Skylark, it's okay if you don't remember. It's okay if you don't remember where the bathroom is. If you've been there a year and we have people who've been there for quite a while and need some guidance and can't remember certain things on a day-to-day basis. That's just short-term memory loss. But at Skylark, that is normalized, and we're not pointing out, well, you don't remember, or you've done that wrong, or put that puzzle piece here. So what we do is find out what the abilities are, what abilities remain, and then we help our members shine in those areas. And typically that will be around music or art, or some people love books, and we have a little library at Johns Creek and they arrange the books, and we have different things that people can do. And that does create an empathetic and positive bridge to activities. So someone's not sitting afraid to do something. So, sometimes that might take a few days. Sometimes that might take a few weeks for somebody to get to that point where they're like, okay, I'm safe here. I can be myself. I'm like everyone else here, and I can get up and do these activities. That rekindles confidence, and it lifts moods, and spirits brighten. Really, we laugh a lot. We have a good time, and our motto is, if people have smiles on their face while they're there and they leave with a smile on their face, then we have done our job. Choice is honored. We do have an activity calendar, and every day there are opportunities for engagement in different areas. However, if one of our members would rather go into the art room and begin an art project, then they can do that. If they would rather sit out in the courtyard and enjoy the sunshine, then they can do that. And that is very important. I always tell this little story about how for a while there in graduate school, I was studying happiness. And I thought it was really hilarious that really a lot of happiness research boils down to, guess what? People are happiest when they're doing what they want to do, just like, we all did as children. So it's very important to be self-directed. And then really community just empowers all of this, because we're together, and you feel that community in the building. This magic also extends to caregivers, because giving support to caregivers is caring for the person. At Skylark, we provide care for the dyad. And what a dyad is the person living with dementia and their care partner or care partners. And science says you cannot just, well, it is not solvent, or it is not as, you don't have the best outcomes when you're only serving the person with dementia. The best outcomes happen when you're also serving their care partners, because this is a very stressful type of caregiving, can lead to health problems and depression. And so when you care for that caregiver, they can stay strong and continue to care for the person living with dementia. So just, I'm not going to read every word on this slide, but definitely a reduced stress and depression, just knowing that there's somebody you can connect with who understands, better relationships, because you can go and see your family, your adult children, your grandchildren during the respite period. But I'd like to say this about the relationships as well. When you become a caregiver, at some time in the early stages, and it happens pretty quickly, it really feels like you lose that role as spouse or sister or daughter, and you are becoming a caregiver. And that can strain the relationship, as anyone who has cared for someone with dementia knows. Um, and the caregiver misses their father or their mother and their role as an adult child. The spouse misses being, a wife or a husband and more of a caregiver. So when you have this very consistent, strong support that Skylark Adult Day Health gives, you can get some of that back. You can stop being the vigilant, constant caregiver 24/7 and begin to enjoy, again, that relationship. The sustained caregiving at home, as I said, is what prevents long-term care placement. So because you are having a break, you are having respite, and you know that your person is in a loving community of dementia care professionals, you can really feel that lessening of stress. So there's a little bit of care planning, and I'm referring to when you would want to initiate adult day health. I cannot stress the importance of starting this in an earlier stage, and that is for the following reasons. And number one, it's proactive versus reactive. I've heard Dr. Ken Hepburn say many years ago, and it struck me and other professionals who've learned so much from Dr. Hepburn, that the diagnosis of dementia is a call to action. And it is not a call to get the diagnosis and then go home and just wait a year to see the neurologist again. This is the time to really start making decisions. So it's very important to make those decisions early. So being proactive versus reactive saves money. It keeps you from maybe getting into a crisis later. Also, the ability to adapt for the person living with dementia, the ability to adapt to new people, to new environments, really lessens as the disease progresses. And so, in a way, it is unfair, in my opinion, to wait, because that waiting just, it increases this chance that they may not be able to successfully integrate or assimilate or acclimate to an adult day health setting, and won't be as successful, or they won't enjoy as much as they would have had they come earlier and really been able to form those trusting bonds and friendships. So let's keep that in mind. Also, it's very important to maintain skills in dementia, and we should not take any of those skills. And by skills, I mean simply having a conversation, walking without loss of balance, without being a fall risk, and any skills, cooking, writing. But I think having a conversation and moving the body and through space and time safely is important. And it really is a use it or lose it type of situation. The brain is being besieged. And so these autonomic things that we do, like getting up out of a chair or talking to somebody, those skills are impacted incrementally through the progression. So it's like working a muscle. You really want to do those things. It gives you a consistent schedule, which is very important. And of course, we've already discussed the health benefits to both the person living with dementia and their care partner. There are other dementia care options, and during the course of the disease progress, you may use one or more, but we thought that it was nice just to mention the dementia care options that we have. We believe, and many people believe, that adult day health is the gold standard, but there are other options. A senior centers are wonderful, really great for seniors, but you do have to have a high level of independence to be at a senior center. adult day services like Skylark. There's in-home care. There are personal care homes, which are small homes with maybe 8 to 10 people. So it's not a big independent living or assisted living situation. Um, and then assisted living, memory care, and continuous care communities. And you see many of, well, there we have a few around Atlanta, and those can look like independent living, assisted living, and memory cares all in one place, maybe with different options. Like some people have an apartment, some people have uh, a cottage. Um, those are continuous care communities. And then you can opt to just live in your home and deal with this yourself. But one of the first things I tell anyone who comes to me seeking dementia care navigation is this is not something that you can or should do alone. It's just very impactful. So we looked at Genworth and Care Scout. This is from 2023. Um, but I think these numbers maintain, and I don't know, Ned would know if the 2024 is out now. It's usually a year behind, but these are still good numbers for you. In-home care is looking like $35 an hour, $30 to $35 an hour, sometimes more. And in-home care companies have a requirement, most all of them, of a 4 hour increments for care. So we are currently at $109 a day for a person living with Alzheimer's or a related dementia. And we are open from 8 to 4. So as you can see, there's a huge difference in price. And I'll talk more about why I think adult day health is just better for dementia than in-home care generally. So you're going to spend a minimum of $2,800 to $5,600 a month if you need care, consistently, let's say 3, 4, 5 days a week for the entire month. There are day respite programs in churches. Those I think very similar to senior centers because they do not have they do not have nurses. They're not a clinical environment. They are good in the early stages, but a person really needs to retain a good deal of independence to stay in a day respite programs. They're generally 2 to 4 hours of care, 2 to 3 days a week. And then adult day health, there is our pricing. Assisted living, I mean, it's 4,000 is low, and those are hard to find. And some of them go up to 10,000, but the median here is 4 to 8,000. And then memory care along those lines as well. There are programs and things that can help pay for adult day help. If of course private pay, and many people do private pay for this service. If someone is a veteran, they can seek to see if they are appropriate for veterans assistance. And if someone is served in a time of war, they almost always are. We work very closely with the Veterans Administration. We are very proud of that. We do education for veterans and really feel strongly about that. There are community-based grants. What do I mean by that? Well, the Older Americans Act provides certain entitlements to anyone that is 65 years old or older, and one of those is adult day help. And so you can reach your area agency on aging if you need some guidance with that. We can help you or talk to you about that further. But there tend to be wait lists for that, but they are in existence. There is an elderly and disabled waiver program. What a bad name, right, for a program? But that's the name of it. The two elderly and disabled waivers are Community Care Service Program and Source. Those are quite intricate to describe and talk about, but generally, this is not the type of Medicaid that you go to DFACS and apply for. You apply for through your area agency on aging. It is there for people that are 65 years old and older and who are living with chronic health conditions that put them at risk of nursing home placement and Alzheimer's or one of the other advanced dementias in an advanced stage are definitely do that. And so, but there are some financial considerations with that program. And if you would like to discuss that with us, we do accept both of these programs and the Medicaid waivers, and we do guide people as to how to apply for those and if you are appropriate, etc. And then any long-term health care policy usually would cover adult day health, and we do accept those as well. So this is where we are. We have a Johns Creek Center and a Cobb Center. We also provide home care, and we are now providing dementia care navigation, which is care consultation and care planning for families to navigate their Alzheimer's or dementia journey. I'm going to stop sharing now because I couldn't see you. But I'd love to talk to you. So could we unmute folks, Ned? How do I do that? Let me. Anu, did you have any questions? There you go. Can you? Is there a charge for the dementia care navigation? Yes, there is a charge for dementia care navigation. And I am happy to speak with you about that, Tanya. If you'd like to share your phone number, I can give you a call, or I can share my number with you. Why don't I do that? Just in case anybody would like to call me directly. Let's see. I'm at 404-410-1511. There we go. And I'm happy to talk about what dementia care navigation is if you would like for me to. Anu, did you have any questions? Nope. Okay. I see you typing, Tanya. Right. So dementia care navigation it's not new. The term is new. But this is a complicated progressive disease. And so it is important to have a care plan. So what I do, and what I've been doing for many years, is I meet with families, individuals or families, generally not the person living with dementia, because it's really important to have a candid conversation. So I meet with families and get an entire history. We talk about everything from clinical to financial to family dynamics, and discuss really where you are. We get a good picture of where you are, and then we talk about goals. You know, what would you rather? What like do you see? Would you ever consider long-term care placement? Would you prefer to avoid that? You know, what is important to you in your life? What are some goals that you would have? And then I synthesize all of that and provide actionable steps and a plan to get the wheels on track, get things organized as far as, you know, schedules and future, what might the future look like with dementia, And in life, really anything can happen. So care plans sometimes need to be updated, but it gives you a pathway to better reach those goals. And much of the time, the care plan includes maybe outreach to expert clinicians if there's not a clear diagnosis, or certain doctors, certain educations. I provide education and coaching during this process. Does that answer the question, Tanya? I hope I did. And I do that by appointment. Good, thank you. Well, it did not take us an hour to get through this program because I didn't have any questions and nobody piped up during the presentation. So I guess if there are no further questions, we will be having another webinar next month, and we'll make sure to get the word out to you and hopefully to more people. So we will have well, this is our first one, as I said, but I think it's great. Oh, thank you, Tanya. I really appreciate you coming. It's been great to have you here, and I'd like to get to know you better, as well as you and you. And Lorraine, we're already great friends, right? Ladies who are here, if you are interested in the virtual caregiver support group, it is excellent. If you are receiving the newsletter, you can that is in the newsletter, but you can certainly call me or email me. Let me give you my email. I send out an email invitation to everyone who regularly wants to come. It is a great support group. Lorraine can tell you, she's there. This is my email. I will add your email to the invitation so you can join us. It is the second Tuesday of the month at 6 p.m. All right, I shall say goodbye and give you 19 minutes of your day back. And hope to speak with you soon. Tanya, do reach out, or if you want to put your phone number and email down, I can reach out to you. Oh, you've got it. Okay, friend. Thank you. Bye-bye, everyone. Have a great afternoon. Great. Thanks, Tanya.